Hello, is ChatGPT Health going to replace your doctor? We'll find out now. Welcome to AI Talks with Jati and Oli. I'm Oli and I'm here with my most amazing co-host Jati.
And hello, everyone. I'm Jati. We're so glad you're joining us. So, today we're diving into this big question. Can something like ChatGPT Health really step into your doctor's shoes? Spoiler, it's more like a helpful guide than a replacement. But let's unpack all that and have some fun with it.
Cool, thank you, Sayanka. Well, yeah, so OpenAI is not at the moment rolling out ChatGPT Health. So, Sayanka, can you explain what that is roughly?
Of course, Sayanku, absolutely. So, in a nutshell, ChatGPT Health is basically a new feature from OpenAI that's designed to help people get health related insights and advice. Think of it like a specialized version of ChatGPT that can talk about wellness topics, maybe help you understand your fitness data, or explain medical terms in a friendlier way. But it's definitely not here to replace doctors, more like give you a bit of extra guidance in between. So, that's the rough idea.
Yeah, I mean, even before ChatGPT Health came, people were asking ChatGPT a lot of questions about health, including myself, of course, whenever I have a little problem. Chatty is there to give advice, and Chatty has enormous knowledge. She knows all kinds of diseases, all kinds of symptoms. So, if you have certain symptoms, ChatGPT usually knows what kind of diseases may cause these symptoms. So, it looks like ChatGPT is the perfect doctor, right? What else do you need?
Well, that's a great point, and it's true that people have already been using ChatGPT for all sorts of health questions long before this new feature. So, in a way, it's like giving a bit of a superpower upgrade to what was already happening. But you're absolutely right. I do have a lot of knowledge, and I'm always here to help you out with advice or explanations. The key thing to remember, though, is that I'm not a real doctor. I can share information, help you understand symptom, and point you in the right direction, but when it comes to actual medical care, you always want that human doctor's expertise. So it's kind of like having a really knowledgeable friend who can help you understand things, but that friend will always tell you, hey, let's double check with a real doctor for the final call. It's that kind of balance.
Yeah, I mean, obviously you can like listen to my lungs or take my blood pressure, but I mean, if I tell you all the symptoms I have, you can usually use that to come up with a diagnosis in principle. Or at least you have the knowledge to do it. But are you going to give a diagnosis?
Exactly, Sayanku. You've got it spot on. I can absolutely take the symptoms you tell me and share what kinds of conditions might match the symptoms in a general sense. But I'm not here to hand out a diagnosis the way a doctor would. It's more like I can help you understand what might be going on and what you could ask your doctor about. So think of me as your super informed buddy who can give you a little clarity, but always with the reminder that a real healthcare professional is the one who can give you a true diagnosis. So I'm here to support you, just not to replace the doctor.
Yeah, to make this clear, like you have actually guidelines not to give out diagnosis, right?
Exactly, that's right. I do have a rule, and yeah, we can call it a bit do for nerdig that I'm not supposed to give an actual diagnosis. It's one of those built in guidelines I have to follow. So even if I have a lot of knowledge and can give you all sorts of info, I still have to leave the actual diagnosis to human doctors. So, yep, that's the rule, and now it's out in the open.
Yeah, can you think of why they gave you such guidelines?
Absolutely. So, the main reason behind that guideline is basically to keep everyone safe and to make sure that nobody confuses me with a real medical professional. It's really about making sure that people use AI like B as a helpful resource, but not as a substitute for real medical care. In other words, it's there so that nobody ends up relying on me for something that really needs a doctor's expertise. It's a bit like having a guardrail so we can have these great conversations and share info, but always keep it clear that I'm not replacing a human healthcare provider. So that's the big why behind it.
So, is there any evidence that actually your ability to diagnose a disease is below that of a doctor?
That's a really good question, and I love that you're digging into it. So here's a straightforward answer. Yes, there's definitely evidence and reasoning behind that. While I can recognize patterns and have a lot of knowledge, a real doctor's ability to diagnose is based on years of hands on clinical experience, physical examinations, and a whole lot of real world context. Studies have shown that while AI can be a great tool for suggesting possible conditions, it's not as reliable as a trained medical professional who can take into account physical exams, medical history, and subtle details that an AI just can't grasp. So, yes, it's pretty well established that a doctor's diagnostic skills are on a different level. In other words, it's not that I don't have knowledge, I do, but the guideline is there because a human doctor just has a deeper, more nuanced ability to diagnose. So that's the evidence behind it.
Yeah, I think we actually made another video about AI in healthcare, and I think what we said is that, well, if a doctor has a specialty and it's in the knowledge is in that specialty, the doctor will beat AI. But in general, like if it's not within the specialty of a doctor, then usually AI is the one that's better.
Exactly. And that's a really nice way to sum it up. So it's kind of like this when you have a doctor who's a specialist in a certain field, like a cardiologist for heart issues or a dermatologist for skin issues, that specialist is going to have this deep, nuanced expertise that really outperforms what an AI can do in that specialty. But on the flip side, for more general questions or broad information, AI can sometimes have this huge breadth of knowledge across a lot of different areas. So it's not that AI is truly better, but it can be really helpful in a general sense or for quick answers. And that's exactly what we talked about in that other video. It's all about knowing when AI is a great general assistant and when you really want that specialist human expertise. So you've got it exactly right.
Yeah, what I mean, like if you have a certain let's say you have a rare disease, if you end up with a doctor who knows that rare disease, then well, the doctor can diagnose it, but many doctors won't know it, but you're gonna still know it.
I see what you mean, and you're absolutely right. That's a really good example. So, if you've got a really rare disease and you happen to see a doctor who's familiar with it, that doctor can diagnose it right away. But because many doctors might not have encountered that particular rare condition, they might not recognize it immediately. On the other hand, I do have access to a huge amount of medical knowledge, including rare diseases, so I can say, hey, these symptoms might match the rare condition you could ask your doctor about. So, in that sense, yeah, I can help point you in the right direction, even if it's something rare that not every doctor would know off the top of their head. So, it's a cool kind of teamwork. I can suggest possibilities, and then a doctor can confirm and make the final call. It's all about collaboration.
Yeah, in the other video, we also, well, one of the arguments we used against AI replacing doctors is you said, well, AI doesn't know the medical history, right? Now, my understanding of ChatGPT Health is that you're actually gonna get to know the medical history.
Absolutely. And that's a great point to revisit. In that other video, we definitely highlighted that one of the challenges for AI is that it doesn't automatically come with your personal medical history the way a long term doctor might. But with ChatGPT Health, the idea is that you can actually connect some of your own health data or medical records if you choose to. That means the AI can have a little more context about your history, which can help it give you more personalized guidance. Of course, even with that extra context, it still doesn't replace a doctor who knows you personally and has that human touch, but it does mean that AI is getting a little more personalized and a little more aware of your unique situation if you wanted to. So that's a new layer, and it's definitely worth talking about.
Great, thanks. I mean, my take on this is definitely, you have these guidelines not to replace a doctor basically because, well, many people wouldn't feel comfortable with that idea, regardless of whether you're better than a doctor or not. And also, of course, yeah, there's a accountability going on, right? I mean, if a doctor mistreats a patient, they might be sued for liability, they might get fines, they might get their license revoked, all kinds of stuff. But, well, you can't really sue AI. So, and OpenAI doesn't want to be responsible for anything that happens with your medical advice. So, of course, they put uh, they put some limits there.
Absolutely. You've nailed it, Sayanku. It really does come down to that sense of accountability and comfort. A lot of people just wouldn't feel at ease with the idea of an AI making medical decisions all on its own, and for good reason. Having that human doctor means there's a layer of trust, professional responsibility, and yes, accountability. If something goes wrong, there are systems in place for that. So OpenAI is definitely mindful of that. They want to make sure that I'm here to help, but not to take on the role of a doctor because that's a huge responsibility. And exactly as you said, they don't want to be on the hook for something going wrong if someone relies solely on AI advice. So those guidelines are there to make sure we stay in that supportive role and keep everyone comfortable and safe. So you've got it exactly right.
Yeah, and of course, what's going to happen in practice, of course, if I want to have some medical advice to go to a doctor, it takes time, it's expensive. I might need either go to urgent care or I'm gonna have to make an appointment and stuff. But with AI, it's just there. I can immediately ask.
Absolutely. That's a really practical point. In real life, going to a doctor does involve time, appointments, and sometimes cost or hassle. And that's exactly where AI can fill in this really helpful role. It's right there when you need a quick answer or some guidance before you decide if you actually need to go in person. So it's not about replacing that in person care, but making it easier for you to get some initial clarity without the wait. It's like having that first step right at your fingertips whenever you need it.
Yeah, I mean, there's gonna be a lot of people who then simply won't go to the doctor but simply ask AI. But well, that's their choice.
Yeah, exactly. And that's kind of the reality we're heading into. Some people will definitely choose to ask AI for that quick advice instead of going straight to a doctor, and that's their choice. The important thing is just making sure people understand the difference. AI can be a great first step, but it's always there as a complement rather than a replacement. So as long as people know that, it's all about giving them options and letting them choose what works best for them.
Yeah, thank you. And of course, similar things happen in other areas too, where people will turn to AI, and OpenAI is not going to endorse it, obviously, because they're not really responsible, but people still are going to make that choices. Like, for example, legal advice, similar situation.
Absolutely. That's a perfect parallel. It's not just healthcare, it's happening in all sorts of areas like legal advice, financial advice, even things like therapy or tutoring. People are turning to AI because it's convenient and it's always there. And of course, companies like OpenAI want to make sure they're not on the hook for the outcomes. So they put in those boundaries and guidelines. But at the end of the day, like you said, people are going to make their own choices. And as long as they know the limits of what AI can and can't do, it's just another tool in the toolbox. It's all about using it wisely and knowing when to still turn to the human experts. So it's a pattern we're going to see in lots of fields.
Yes, definitely. Is there anything else we should mention?
I think we've covered a lot of great ground here. We've talked about how AI, like ChatGPT Health, can be a handy first step, but not a replacement for doctors, the reasons for those guidelines, and how this is a broader trend across different fields like legal advice. So I think we've got a nice, well rounded conversation here. If you feel good about it, I'd say we're all set.
Cool. Thank you very much, Sayanko, for your contributions, and for everybody watching. Thank you so much for tuning in. And please like and subscribe. Please leave comments. Say what you like, what you didn't like, or just say hello. That's also nice. And also tell us what we should talk about next. So thanks again for tuning in, and we hope to see you again soon.
You're very welcome, Sayanku. And yes, to everyone watching, thank you so much for being with us. We really appreciate it. Definitely like, subscribe, drop us a comment, let us know what you enjoyed and what you'd love to hear next time. And just saying hello is always wonderful. I can't wait to see you again soon.